Imagine your body running dangerously low on insulin, the hormone that helps sugar enter your cells. Suddenly, your body starts burning fat at a frantic pace, flooding your blood with acids. That's exactly what happens in diabetic ketoacidosis, an emergency that can strike fast and hit hard, especially in people with type 1 diabetes. At first, it might feel like a bad flu or a stomach bug. You're thirsty, tired, maybe even a little nauseous. But behind the scenes, your blood is becoming dangerously acidic. Your body is losing water at an alarming pace, and your brain is starting to shut down. If not promptly treated, it can develop rapidly and progress to coma or death. Early recognition of symptoms and urgent medical care are essential for a favorable outcome. Diabetic ketoacidosis is a severe complication of diabetes that results from insulin deficiency. Although more common in type 1 diabetes, it can also occur in people with type 2 diabetes, particularly during severe illness or major stress on the body. This deficiency can be first indication of type 1 diabetes, as other symptoms may not be easily noticeable. Diabetic ketoacidosis can happen if a person misses an insulin dose, uses it incorrectly, or if their insulin pump malfunctions. It can also be triggered by infections, alcohol, or drug use, injuries, or serious medical problems like a heart attack or stroke. When insulin is lacking, sugar cannot enter the body cells, leading to a rapid buildup of sugar in the bloodstream. This causes sugar to be excreted in urine, which also depletes water and can lead to severe dehydration. Insulin is also crucial for regulating fat in the body. Without insulin, fat is released from adipose tissue into the bloodstream, resulting in a significant increase in blood lipids, particularly triglycerides. Since the body cannot utilize sugar for energy, the liver begins converting available fatty acids into ketones, which serves as an alternative energy source. However, ketones are acidic, and their accumulation in blood leads to increased acidity, a condition known as acidosis. This is why the disorder is referred to as diabetic ketoacidosis. Ketones will also appear in the urine, which is useful for diagnosing this condition. Both dehydration and acidosis impair the function of all body cells, including the brain cells. In rare cases, especially in children, rapid correction of diabetic ketoacidosis can cause a life-threatening swelling of the brain. Initially, symptoms develop gradually, presenting as increased thirst and frequent urination. If these signs are overlooked, more serious symptoms can quickly follow, including severe weakness, stomach pain, and intense nausea and vomiting. Dehydration may lead to dry mouth, muscle cramps, headaches, and in severe cases, altered awareness ranging from confusion to coma. Drowsiness, lethargy, and difficulty waking up are signs that condition may be becoming life-threatening. The buildup of ketones and acidosis causes breathing to become deep and rapid, and patient's breath may emit an acetone-like fruity odor. High levels of triglycerides may also trigger acute pancreatitis, another potentially life-threatening complication. To diagnose this condition, a doctor will first gather essential information, asking about the patient's symptoms, medical history, and any ongoing therapies. Basic laboratory tests are typically sufficient for an accurate diagnosis, although further tests may be conducted to identify potential triggers of the condition. These tests include blood glucose, serum ketone concentration, and measurements of blood acidity, such as arterial pH and bicarbonate levels. Most cases of diabetic ketoacidosis require hospitalization, with some instances necessitating treatment in intensive care units. Treatment generally focuses on rehydrating the patient with intravenous fluids, replenishing lost electrolytes, and managing blood sugar levels with insulin. During treatment, potassium levels must be closely monitored and corrected if necessary, as insulin therapy can cause a dangerous drop in blood potassium, which can lead to disruptions in normal heart rhythm. Any underlying conditions that may have contributed to the onset of diabetic ketoacidosis should also be addressed. The outcome of treatment depends on the cause of the ketoacidosis and the time between the onset of the condition and hospital admission. If patients seek medical help promptly, the prognosis is usually good, and the disorder can often be resolved within a few days. However, failure to recognize symptoms early can lead to progression to coma and respiratory failure, which can be fatal. Preventive measures for diabetic ketoacidosis are important. Regularly monitoring blood sugar levels, adhering to prescribed insulin therapy, and maintaining blood sugar levels as close to normal as possible are essential steps. Individuals with type 1 diabetes should monitor for ketones during illness and never stop insulin completely, even when not eating. In many regions, ketone test strips for both blood and urine are readily available, and individuals with type 1 diabetes are advised to keep them at home. If you are uncertain about how to adjust your insulin based on carbohydrate intake, planned physical activity, or illness, be sure to consult your doctor. Diabetic ketoacidosis is a critical condition, but one that is both treatable and preventable. With timely recognition and proper medical care, most patients recover fully within a few days. However, every hour counts. The difference between a manageable complication and a life-threatening emergency often lies in how quickly the warning signs are recognized and acted upon. For those living with diabetes, diabetic ketoacidosis is a reminder that managing this condition goes beyond the numbers on a glucometer. It means listening to your body, being prepared for the unexpected, and knowing when to seek help. It's about staying vigilant, not fearful, informed, not overwhelmed. Because in the case of diabetic ketoacidosis, awareness truly can be life-saving. Thanks for watching. If you found this video helpful, consider subscribing to more educational content. Have a great day.